We are going to talk about health and housing and the opportunities that we've had to do some convenings around the state. We are very excited. I'm Lisa Vatsky. I am the Director of Multifamily Housing and Community Facilities with the Washington State Housing Finance Commission. Welcome. Very psyched to have a panel with Tracy, who I'll let these folks introduce themselves, but Tracy's coming from the other Washington, the dysfunctional Washington, as we heard today. We are the functional Washington.
Not my fault.
No, it is not your fault, but Priya introduced us to that concept that she's from the dysfunctional and we're from the functional, so we'll take that. And Melody from the Department of Commerce, who's running the Apple Health and Home. So who's in the room? Can we get a sense of who's in the room? I know there's some healthcare authority folks. Shout out to the healthcare authority folks who have been big partners in some of the work that we've been trying to do. So maybe you all could wave your hands. Oh yeah, great. Who else? I know there's some more Department of Commerce staff. Yeah. Oh boy, yeah, oh boy. There's a couple of commission folks I know in the background there, okay? And then our service providers, developers, owners, owners may be the same. Who else? Public funders? Any other public? Well, there's, well, it's not, oh, yeah, okay. Oh, Brian. Yeah, hi, Brian. Anyone else want to shout out? Architects, thank you. Yes, cannot forget the architects. Great. All right, well, that's super helpful to have a sense of who's in the room. So, yes, we plan to talk about this initiative that we've been a part of. We've been a Washington State, and the Commission has been part of a cohort of 6 other states. We're six states across the country through our NCSHA, which is our, oh, let me back up. Why don't you do a quick introduction? Your panel today.
Good afternoon. I'm Melody Pazalt. I'm with the Department of Commerce in the Office of Apple Health and Homes.
Hi, Tracy Kaufman, a consultant and senior advisor at the National Council of State Housing State Housing Agencies in Washington, D.C.
Thank you. Okay, so goals for today. Talk about what we are doing and some of the national level initiatives that we've been a part of, but also information on how we're navigating and collaborating with health and housing partnerships across development, operating, and services, the 3 legs of the stool. And then other resources that we're in the process of working on, and then hopefully some time for question and answer. So we've had the opportunity through NCSHA, which is the National State Council of Housing Agencies, through a Robert Wood Johnson funded project we applied for and were lucky to award a planning grant. And through that effort and through working as part of this cohort, we've incorporated Corporation for Supportive Housing, CSH. And is there anyone in the room from CSH? All right, thank you for being here. So we've been working with CSH closely in implementing this grant. We've also, as part of the cohort, been working with the Center for Community Investments. Has anyone had the opportunity to work with CCI? I highly recommend them. Oh my gosh, they have been amazing partners in supporting the cohort of 6 states and really helping us think about a framework that has been really helpful in reframing. You know, I've been in this work for 30 some odd years, and the framework that they had about thinking about shared values and then creating a pipeline and then thinking about collective impact has been just super helpful in reframing how we can look at partnerships differently and maybe do business differently. And that's been a basis and a foundation for how we've approached our convenings, which I feel like have been super productive in all of us learning more about the challenges and opportunities we can have having housing developers and the healthcare industry working together. And that is really the whole point of the network, supporting the development of partnerships with hospitals, healthcare systems, and other health organizations to expand financing for affordable housing preservation and development. And so, many of you may already kind of know why we would want to do this, but, really thinking about how health disparities and having stable housing, how they're so interconnected. So, how can we then, knowing that those things are so connected, how do we connect those systems which have pretty traditionally been siloed? So really thinking about how we improve a community's health outcomes, and we know that housing is a big piece of that, and how do we really talk about and know that the increased costs for health care, if we're working together in partnership, we can reduce some of those costs. How do we just encourage more partnerships between health and housing providers has been a main focus. Clearly, timing is everything, and we still have quite the crisis at hand, so certainly trying to connect these dots in a way that we haven't seems like an opportunity. What we pitched to NCSHA and the Robert Wood Johnson Foundation was that we know that we've had individual successes with projects, again, very project focused. And what we called one-off kind of projects, and how could we create a more systems-based approach, knowing that we've got some great experiences here in our state already of particular partnerships and particular projects that have been successful in bringing housing developers and healthcare providers together. And I've got some great storyboards and examples of those, but how do we really go beyond that? And then really trying to piggyback, use the energy and catalyst of the Apple Health and Home, and creating a whole new office in the Department of Housing, and $100 million commitment to bringing all of these resources together. What an opportunity we thought we had to really kind of figure out, okay, how do we really build a more systems-based approach? So with that, I'm going to turn this over to Tracy. Tracy's going to talk a little bit about the national initiative and some of the reasons why folks have come to the table at the national level. And then we'll hear from Melody about Apple Health and Home, and then we'll have a chance to share some stories and hopefully get to some questions and answers.
I hope that's the right PowerPoint, because it looks like the wrong one, but let's,
It might. Oh, yeah,
let's
it is
see what happens.
the other way.
Let's see. I don't know. We'll find out. There's some chairs up here if anyone in the back actually wants, up on this side in the front, if anyone wants to come forward. So thank you, Lisa, for having me. Happy to be on this panel and in the great state of Washington and be on this panel with Melody. So as Lisa said, in the spring of 2022, I think, NCSHA launched the Healthy Housing, Healthy Communities Partnership Initiative. I will no longer say that. I'll refer to it as H3C. It was funded, as Lisa said, by the Robert Wood Johnson Foundation. We worked in partnership with the great Center for Community Investment, and we funded 6 state housing finance agencies. The idea was to build partnerships for the HFA, to build partnerships with health institutions that would create new investments from the healthcare sector into affordable housing. So Washington State's a little ahead of the game in this. A lot of other states, this was really a new concept to create new investment from the healthcare sector into the development of affordable housing. So those are the 6 states. They're a little small there. So it's Colorado, Illinois, Nebraska, Pennsylvania, Rhode Island, and Washington. So we created this cohort. We created a learning community among those 6 states where we regularly engage with each other. We learned from each other. We informed our approaches. And we ultimately, each of the states will create or are creating models and programs for other HFAs that other HFAs will ultimately be able to use to create their programs. Lost my thing here. So the big picture of the initiative, there were really 5 overlapping goals. Each HFA is creating partnerships with one or more healthcare entities and engaging with their local communities to inform their programs and approaches. The ultimate goal is, of course, to expand financing for affordable housing. And like Lisa said, not just for one-off projects, but to really create a program that develops a pipeline of projects with healthcare investments. So very focused on the pipeline, on the development of the pipeline. By the end of the initiative, each of the HFAs will have specific financial commitments from their healthcare partners, and those can be really a range of things, and I'll talk about them in a minute. And with CCI's, with the Center for Community Investments expertise, we created a process in which the cohort talked to each other and learned and grew together and built their programs informed by this peer network. Ultimately, at the end of the year and going into next year, we'll leverage what we learned through the initiative to inform the approaches of other state housing finance agencies around the country. So just to be clear, so when this initiative ends at the end of this calendar year, that's really where the real work and impact begins for the agencies. Once the HFAs have their plans in place and their commitments solidified, then they're going to have to focus, then they'll be focusing on implementation and launching of those programs, and trying to figure out how to institutionalize the work that they've done over the last 18 months or so. So why would health institutions be interested in investing in affordable housing? I think most people in this room know most of the slides, so I won't read it. It turns out there's lots of motivations on the healthcare side. They understand that investing in the social, economic, and environmental conditions of their patients can indeed lead to better health outcomes. Hospitals and healthcare systems care about their reputations. They investing in neighborhoods can increase their competitiveness, and it gains them support with decision makers. The investments can be very strategic, and in some cases can generate both direct and indirect returns.
So Tracy, do you know offhand, did the Center for Community Investment, have they done specific research in those? I'm seeing that there's a question already in the chat, and I highly recommend folks use this because I'm tracking. So if folks have questions as we go,
Yeah.
If there's specific studies, do you know if they've done
For
any?
each of these?
Not necessarily each of them, but specifically showing.
Yeah, I mean, I think that they have some case studies, and they've written a lot. I don't know that any of them are, highly rigorous academic studies,
Right.
but certainly they've written a lot on motivations of the healthcare sector and how to align. Lisa's heard this a lot over the last year, and how to align your goals with the housing goals with the healthcare goals, and how to speak the same language. And there's a lot around that, and if anyone wants more information on that, I can get it to you. Hit me up. I think there's contact information in the app. So happy to share information after this. But yeah, I'm sure they have a lot. So at the beginning of this initiative, we really pushed the cohort and the HFAs to consider the range of the types of investments that the healthcare institutions might have at their disposal, and there is really a bit that they have available. They can bring actual funds to the table, of course. They may have property that could be used, and most certainly they have expertise and relationships that can help. So, as we knew would be the case when we began, when we launched the initiative, the agencies have really developed this range of approaches that both fit their needs and tap into the opportunities in their states and their communities. So I can't yet really identify who's done what, because some of it's not quite public and they haven't publicly launched their programs.
We have to do a final report by December.
Something.
By December.
By the end of the year. Let's call it the end of the year. Yeah, and their programs are deep and they're very, very thought through and they have commitments, but just some of them haven't publicly released that yet. So probably not a great idea for me to do that for them. So, but this is sort of the breadth of what I'm seeing. Some are working with hospitals, I mentioned this before, that have vacant or underutilized property. One in particular is building a partnership with a pretty large developer, private developer, and the hospital system will donate the land or will use their unused land, and they'll tap into HFA resources. It's going to really transform a pretty large area around that hospital. A few of them are creating incentives or set-asides in their low-income housing tax credit programs that are specifically for developments with healthcare investment or healthcare partners who are investing in those developments or in that project. All of the HFAs have committed their own resources. Some of the HFAs, some of the cohort have pretty successful approaches to helping connect affordable housing developers to the healthcare institutions, and they're beginning to see the fruits of that labor. One of the states called it, they had a really good speed dating event that now they're actually seeing some deals coming through the door from that specific event, actually several deals coming through the door just because they are able to put people in the same room together. Everyone in the cohort in some way or another provided technical assistance in order to begin to create a pipeline of projects with healthcare investments. And particularly interesting to this group, and we'll hear a lot more about it, I hope, from Lisa, Washington State led the way, the commission led the way in really stepping back and looking at the larger context and to try to create systemic change by working across state agencies. So I'm sure Lisa will talk about this. It really excited me as a Washington, D.C. policy geek that Washington was doing that, and the other states were really interested in how that was going and what was happening with there. And I'll just say to that, those are not easy conversations. And those changes aren't easy to make, but the potential impact is significant. So that's exciting. So outside of the H3C initiative, and thanks to the Center for Community Investment, these are just a bunch of examples of healthcare sector investments in affordable housing around the country. And this is outside of our initiative, so I can't really talk to these individual examples, but I thought that having concrete examples for you all, I put them in their resources. CCI has case studies and details on every single one of these, so if something is really interesting to you, hit me up after, and I can send you details on any of these. So I'll just wrap up by sort of stepping back and going, we're not quite at the end of the initiative, and we'll do a big analysis and think hard about what we learned and how we go forward. But when I stepped back to try to think about what seemed obvious, what have we learned that seems really obvious at this point? And these were the 5 things that I came up with. So don't go it alone. This is a team sport. Find a champion or be the champion in your agency, and find a champion in the healthcare, in your healthcare partner. Seek to maximize impact. How can your dollars and activities have the greatest ripple effect? Engage your communities, key one. Find community groups, listen to them, incorporate their voices, create ongoing engagement, adapt, and then go back and listen again. Make it strategic. Maintain focus, think systems, create programs that lead to pipeline, not one-off projects. And this one came up, we just had our final big cohort meeting 2 weeks ago, and this kept coming up. Everyone kept saying, just jump in and do something. And so I've heard that a lot. Just keep going. Don't wait for the perfect opportunity. Just get started. So I'll end there. There's my contact information. I think it's in the app too. And happy to take questions now or wait when we have time at the end.
Yeah, I've got a couple in here, but they're more global, so let's have Melody go, and then we'll
Great.
jump into some of these questions maybe before I get into them.
Thanks, Tracy. Thanks, Lisa. So I just want to call out another state agency that's also here, the Department of Social and Health Services. Both Aging and Long-Term Supports Administration is one of our key partners on the Apple Health and Homes program. So I just want to call, I saw Whitney Joy, there she is. She's also a healthcare partner that I want to make sure that is also called out here as well. And I also see Shang from the Developmental Disabilities Administration too, another partner. I think that's also a great opportunity to, when we think about these partnerships between healthcare and housing, I think Department of Social and Health Services along with the healthcare system is crucial to have these conversations. So as we mentioned earlier, my name is Melody Pazalt. I'm with the Department of Commerce. I've actually been with the Department of Commerce just a little over a year, and so actually previous to that have spent most of my 35 years in the behavioral health system. And so this is, let me tell you, the housing system is complicated. You guys speak another language. And so it's been a lot to learn over the last couple of years, and to really immerse and learn about the capital projects and how to build housing. And I love what Governor Inslee said this morning, that the only thing that's going to solve homelessness is housing. And I 100% agree with that. The only thing that is going to solve homelessness is housing, but it doesn't solve everybody's problems. We still need those ongoing supports to help that person in housing. And that's where permanent supportive housing is a fantastic model. And so when the Department of Commerce and Karina Gregoris, our leader at the Housing Division in the Department of Commerce, a little over a year ago created a housing division, they created a unit dedicated towards permanent supportive housing. And so our unit has sort of everything around permanent supportive housing. We have an advisory committee. We operate the operations and maintenance program. We have a number of housing resources. A lot of my staff are here. I want to call you guys out, wave your hands. A lot of our programs are represented here. Everything around permanent supportive housing. And then this bill was passed in the 22 legislative session called Apple Health and Homes. How many people know that Apple Health is the name of our Medicaid program in Washington State? Yay, that's good showing. So that's sort of the foundation for Apple Health and Homes, is that this is really pairing Medicaid funded services with housing. And so, you said there was a question about social determinants of health. And, I think that the housing and homelessness system has really been acknowledging that, for people that have health, behavioral health, long-term care needs, how important housing is for recovery from those conditions. You guys have gotten that for years. Healthcare system, behavioral health system, it's taken us a little bit longer to catch on to that. And so, especially the federal government. And so the Centers for Medicaid and Medicare came out with actually a policy paper in 2021 to state Medicaid directors saying, we think that Medicaid can be a great tool in using Medicaid funds to pay for the services to help people obtain and maintain housing. And so they know that when you pay attention to the whole person, when you think about not just their symptoms, not just their diagnosis, but really their whole person, that actually can help improve healthcare, reduce costs. And so let's use Medicaid innovatively to serve the whole person. And so by focusing on social determinants of health, housing, nutrition, transportation, employment, income. And so these social determinants of health became an opportunity of using Medicaid innovatively. And one of the ways of using Medicaid innovatively are these vehicles called waivers. So Washington applied for an 1115 Medicaid waiver in 2015, and we were one of the first states to actually use Medicaid innovatively to be able to help people obtain and maintain housing. And that's called Foundational Community Supports. That's the program that we're using in Washington State. Now, in 2022, a group of legislators with Representative Chop leading that way sponsored a bill to say, let's use this innovative program, Foundational Community Supports, because that's one of the I think the challenges that the permanent supportive housing programs in Washington State had was paying for the services. That was one of the most difficult things that I think that the housing and homelessness system had was we don't have those resources to pay for the services. And so if we can use Medicaid to pay for the services, then that maybe will free up some resources for the operations and maintenance and more capital. Well, let's take that a step further and let's actually bring housing resources and marry it. Let's really coordinate it with this program. And so that's where the Apple Health and Homes program was really created. And let's create a dedicated office within the Department of Commerce. And so the office, at the same time as this permanent supportive housing unit, is really where we're really concentrating on launching this new initiative, which is this concentrated approach around working with our healthcare authority partners, our DSHS ALTSR partners, around the Foundational Community Supports Program, and working with our multifamily housing unit. I'm trying not to use acronyms. The MHU team, the capital team at Department of Commerce that has the capital funds, and bringing capital rent assistance to those individuals enrolled in Foundational Community Supports. Now, there's about 11,000 people enrolled in supportive housing in the Foundational Community Supports program, so the eligibility is a little bit narrower in the Apple Health and Homes program, but it is an opportunity to really try and bring these three legs of the stool together in a really coordinated effort. And so the state agencies, ALTSA, the Healthcare Authority, and Commerce, we work very collaboratively. We're meeting almost weekly to really work on how to make this happen. Look at the capital funds, look at the rent assistance, the operations and maintenance resources, look at who's eligible on the services side. It is a little bit of a different eligibility typology than maybe what you are used to through coordinated entry, through your local funding sources, because again, we're trying to think about healthcare, Medicaid, who's eligible, because that's diagnosis-based. It's an insurance program. And so we have to think about the Medicaid eligibility and then bringing housing resources and marrying them together. And so there's a lot of coordination that we're trying to do. And when you bring capital funds that are also stacked with all of these other funding sources, then there's a whole nother layer of complexity. And so we're really working closely with those first 7 organizations that received our first awards to really think about how to actually operationalize this. We're working closely with the Housing Finance Commission on, gosh, could we actually use Medicaid eligibility for income eligibility? They're already actually determining income eligibility on the Medicaid side. Could that be a system change effort to actually look at eligibility, income eligibility on the capital side? And so those are efforts and conversations that we're having on a system level approach to bringing these three legs of the stool together. Now, Apple Health and Homes is a concentrated effort around permanent supportive housing. There still is a bigger permanent supportive housing effort, and there still is other resources around permanent supportive housing. Apple Health and Homes is just a concentrated, targeted initiative. So I don't want to say that all permanent supportive housing is Apple Health and Homes, It's not. Apple Health and Homes is a very specific initiative where we're trying to align these three legs of the stool together. But this is an effort that we're trying to think thoughtfully about, and an opportunity to really think and improve the quality of permanent supportive housing and align it with the definition, the RCW definition of permanent supportive housing. There's also other ways to do permanent supportive housing that I just want to kind of touch on, and I think that this is also a little bit of an opportunity and a little bit of a soapbox for me in thinking about a paradigm shift for people, particularly people that are complex, and trying to match people with housing. And so looking at, tenant-based rental assistance, whether we do scattered site, single site, maybe, having more opportunities for master leasing or project-based. And so really looking at a portfolio, and I think somebody said this earlier, is that we need all kinds of housing. And that means that we need to match people with the environment that they need to be successful. And when we have people that have really complex issues coming out of inpatient institutional settings, that have behavioral health conditions, that have complex long-term care needs, then we need to match people with the environment that they need to be successful. And so that's another big part of what we're trying to do with the Apple Health and Homes initiative. So just like with permanent supportive housing, where there's lots of different kinds of ways to do the model, there's different partnerships with housing and the healthcare system. And I think that that can also come in different forms and different models. I think that so one of the initiatives that we have, so we actually have capacity grants that we are also helping organizations with if they want to learn more about becoming an FCS provider, if they want to actually partner with an FCS provider. We've got some capacity grants that we issued to help organizations. One of the capacity grants that we gave out this last year was to the Community Health Network. And so they are a network of federally qualified health clinics. And they developed a learning collaborative between their community health clinics. And so this was actually a slide that we presented to them because it was really interesting. So the community health clinics want to develop partnerships with housing owner operators and developers. And so then Lisa comes in and says, well, we want to do this Robert Wood Johnson project, and we want to develop stronger partnerships with the healthcare system. And it's like, gosh, we're doing that on this other side too. So it's really this really unique opportunity to how do we bring the healthcare and the behavioral health system and the housing and the developers, how do we bring these different partnerships together? And those can really look different. It can look different in your partnerships, whether maybe you are having a partnership where you're operating the rents and they're just making referrals. Maybe you have a partnership where you have a nurse coming into your clinic, to your housing unit. Maybe you have a partnership where they're the service provider and you're developing the housing. Those partnerships can really look different, but how do we develop more opportunities for your organizations to have those partnerships? Maybe you're an owner-operator and you want to have an FCS service provider come and provide the services in your PSH. There's so many different unique opportunities, and I think that that's where the learning collaboratives are really about this cross-system opportunity to cross-pollinate these resources and opportunities. So some of the things that we're doing to promote that is, these capacity grants, technical assistance. We've got enterprise community partners that are also here to provide technical assistance. We're here to provide technical assistance on permanent supportive housing. We have our PSH trainer. I know that the Healthcare Authority also does a plethora of training and technical assistance, and we also have our capital program. So that's a lot about what we're doing in the Office of Apple Health, and also things that we're trying to do to promote more of those healthcare, behavioral health partnerships between the housing developers, housing world. So I'll turn it back over to you.
Yeah, I will just interject with a question about how do you match individuals with housing. Maybe you could talk a little bit more about how the FCS program kind of connects those dots.
Certainly. I think that, it is, in a scarcity of resources, it is very difficult. But I think we have to be thinking differently about the environment that a person needs to be. So if you have someone who is coming out of maybe substance use treatment, or thinking about the environment that they came from, or the community that they came from, you don't want to have them go back to a neighborhood that maybe triggers that where they started using. Maybe an individual who has internal stimuli from voices wants to live in an environment where they can turn their music up really loud. So living in a big apartment building may not be a good match for them, because maybe they self-soothe from those voices by turning the music up. So paying attention to the environment that that person needs to be successful in is really about the assessment that we need to be getting to, and thinking about what kind of environment does that person need to be successful in. I think it's also, thinking about trauma-informed architecture. As we build more permanent supportive housing units, and thinking about how does the environment impact people that are coming from really traumatizing backgrounds. So there's really a lot of new opportunities in thinking about trauma-informed architecture, blind spots. There's also, I think, just paying attention so what FCS does is they do a housing assessment, and as we're developing those housing assessments, really thinking about the environment that that person needs to be successful, and doing our best to match that person and give that person choice, power, and control over the environment that they want to live in is one of the best things that we can do. And I know that that's really hard in an environment of scarcity of resources. Whitney Joy.
Just to add to that, you were saying at the end, so I'm going to kind of repeat what you just said. So instead of matching, you can also just say it's going back to the comment that the governor said before. You were like, somebody said this earlier. Creating all kinds of housing. Also then, in terms of like the matching, is then providing true choice for individuals, because we have an array of housing options to be able to offer them and help support some of those needs, right?
Yep. I paid her to say that. Yeah. I have plants in the audience that are supposed to help me, pick up where I slack.
Great. For now, let's transition a little bit and see if I can answer some of these questions as we kind of go. Let's see this way. So, some storyboards. So here's some examples of projects, very specific projects that we've seen, and we brought. We've had 3 convenings now. We started in Seattle, King County, and brought together all the partners in a handful of these projects. So we picked 5 projects and brought together all the partners and spent several hours in a room together talking about all the challenges and opportunities and trying to tease out some of the lessons learned. And from there, we decided we should really have a state agency convening, because there are just so many, I see them, I've got the both. There's so many different challenges and opportunities with all of these, with braiding. That's the word I kept hearing from that. How do we braid all these resources? How do we meet people where they are? How do we're so siloed, in each of these systems. Okay, we can partner, but there's still all of these silos that we have to break down. So how can we, so coming out of that initial convening, we really pivoted to can we get all the state agencies in one room? And, again, the commission is kind of coming in, having been on the, very steeped in the development side, not, specifically tied into Apple Health and Home, but,
we originally went into this grant thinking about how do we align the resources, and we've got some resources. We know that we've been, pretty active with our low-income housing tax credit program in supporting permanent supportive housing, but how do we really align that resource? And again, all the efforts that were going on in Apple Health and Home, how do we, weave all of that together? So one of the projects, Cedar Crossing, a joint development of Mercy Housing and Bellwether. So you had two development organizations partnering. So that in and of itself was kind of a big partnership. But then you had Seattle Children's Hospital, Mary's Place, Seattle Housing Authority, Sound Transit, El Centro de la Raza, and Roosevelt Neighborhood Association. So, a bunch of different organizations trying to partner together. Again, huge stack of financing between our program, the commission's programs, as well as the city of Seattle, King County, and the Housing Authority providing operating support. So that was one example. Then a project that we did with Providence John Gabriel House. This was an elderly serving seniors, and we had shelter resources and Bellwether Housing. And again, a huge capital stack, but on the service side, full-time on-site resident coordinator, and the PACE program, the program of all-inclusive care located on-site. So another opportunity for some partnering there. Hobson Place, the Downtown Emergency Service Center, and Harborview Medical Center partnering together in a project. So a clinic actually in this project, open to the broader community, on-site full-scale healthcare clinic on the bottom floors with tenants, supportive housing above. Again, a huge stack of financing went into this project. And all kinds of dollars on the clinic side from the Commerce Behavioral Health Facilities Program, Building Communities Program, and then Harborview themselves, the City of Seattle Human Services Department, and so all kinds of financing sources to pull this project together. Then Plymouth on First Hill, another project with Harborview and the Plymouth Housing Group. Again, on-site medical and behavioral health care from Harborview medical staff, wraparound support from Plymouth Housing, the DESC's mobile response team providing behavioral health crisis intervention, and up on First Hill, so right kind of centered in a whole medical district area, basically. Again, operating and services, a big piece of this puzzle, and the stacking of all the capital financing. And a lot of what we heard was, again, the language and really trying to develop an understanding of each other's acronyms, just as a base, starting with the acronyms, but, how challenging it is to really break down those silos, understand each other's systems, and try to work together to bring some of this together. So I think there was a lot of not just get going, but get going early and really try to develop a relationship before you go headlong into thinking you're doing a project. And I think that was, a lot of what precipitated our third convening, which was a convening in the greater Columbia region. Oh, and we also got oriented to what I call the affordable, accountable communities of health. So there's a whole network in our state and geographic region of folks that are trying to partner, again, in the healthcare side. We had originally been thinking about hospitals. When Robert Wood Johnson Foundation came to us, I think it was very focused on hospitals, and as we continue to convene folks, it was like, well, what about the clinic? What about all of these other levels? And so, yeah, really thinking about, it's not just hospitals, it's beyond hospitals, but hospitals, so there's like these systems piece, and really trying to peel that onion in terms of like, what are all the different players that could be at the table. So broadening it beyond hospitals, I think, in our state has been something that's been a big learning on our side. So again, another project here, this was with Plymouth and Swedish. Again, looking at on-site services and apartments and bringing together those capital and operating dollars. So we asked, what have the successes and challenges and barriers been? How has the project contributed to racial health and equity in your community? And what are your top 3 wishes for moving forward? And, you know, I mentioned the language piece, right? There are different language and requirements across each of these sectors. The application processes are not aligned. And so one of the big things Melody already mentioned, I feel like, and this was something that totally came out. This was not originally a goal that we set when we applied for this grant, but really thinking about if we could streamline the eligibility, if we could just do one thing, if we could do that would feel like a pretty big success in terms of the clients, the tenant piece, as well as just the bureaucracy of all these different systems, and is there a way we could just take one kind of piece out of this? So we're super excited about the opportunity to figure that out, and I know we're like headlong into that process, and I do hope that that is one of the main outcomes that we'll be able to share. Funding and financing. Multiple funding sources are complicated with different requirements, and again, it's just so complex at the provider and at the individual level. So again, you know, hearing that so often, you know, is there something we could do? And it feels like, again, that eligibility piece is one of the low-hanging fruits, but clearly there's a whole nother opportunity for us to think about all that. So many there's been so many pieces of this puzzle. We're trying to put together a big matrix. Again, there's been kind of a service side matrix. So can we add the capital? So, you know, how do people navigate trying to figure out all these resources? I don't even know how people do it. So, I mean, kudos to all of you who have been able, you know, those projects that were able to do it, again, on these kind of one-off. So is there a way to really bring a more systems approach and try to educate folks to all the different streams and all the different ways people have been using these resources? What are the eligibility requirements? So we have this big matrix that we're trying to put together. So that'll be another deliverable I'm hoping will be helpful in terms of just kind of laying out all the streams. Because even though there's a lot that's been consolidated into Apple Health and Home, there's still a bunch of other streams and other agencies that folks could tap into. So really trying to provide a bit of a map and help folks to navigate that is still one of the outcomes we're hoping to achieve. And then, needing a relationship and connection with all 3 legs. And again, you know, a big discussion about permanent supportive housing units and the need for those in communities, but also respite care. Respite care has been an ongoing kind of gap in this whole system. Who provides it? How do we build for it? And so is there ways, and I was sitting next to someone yesterday from Olympia who's working with Providence and trying to get more respite beds and trying to put specific beds in shelters or in other configurations for that respite care. So, you know, again, how do we try to fund things that maybe are slipping through the cracks? And so, again, I feel like that matrix might be another way for us to think about advocacy, because we can identify all these things that are helping to address certain things, but then what are the things that aren't being addressed, and can that help illuminate some other things that we should be doing and talking about with legislators? So again, most of what we've been doing is convening, and from those convenings we've had a bunch of lessons learned that we're hoping we can turn into some real deliverables. Hosting the Columbia Regional Forum, where we really had an opportunity to hear what are the different challenges east of the mountains in those more rural parts of our state, and how that accountable communities of health, affordable accountable communities of health, are really working together and partnering in a way that's very different from Seattle-King County. So really helpful to be able to bring each state's, you know, the region's different frameworks together to be able to hear and listen and continue to refine and streamline. So that's really our goal. So from there, I'll open it up. I know there was questions in the chat.
Just a little fun fact while you're searching that is that ACH's Accountable Communities of Health are Initiative 1 of the 1115 waiver.
Oh, so that was what you did in the first waiver?
Well, no, so the 1115 Medicaid waivers had 3 initiatives initially. So initiative 1 was the ACH's, initiative 2 was expanding long-term care services, and initiative 3 was FCS. So it's all part of the same waiver. So the ACH's are really part of the 1115 waiver that FCS came out of. So they're
That's great. There was a question about the VA. Are you aware if the VA medical centers would partner with housing developers? And I am aware of a project in Vancouver that built on the VA campus. So I do think there's opportunities actually to work with the VA system. There was some complications, I will have to say, about like putting our regulatory agreements on and their property. Oh my gosh, it was a whole big thing. Do you remember this? Yeah, you're shaking your head. I'm like, oh, did you? Yeah. But we figured it out, and I know that there's a housing project on a VA campus. So yes, I think there's opportunities there. Our healthcare hospital system has a rural access designation that apparently prevents them from direct involvement with support. We're discussing how to partner. And so hopefully you've gotten some ideas about other ways maybe to partner, but happy to talk more about that, or if anyone else has ideas they want to share.
Might try the state VA. So there's a state VA system as well. So the state WDVA might be a strategy to get into the federal VA system. So the state WDVA might be a first strategy to build that partnership with the state VA system. So they're great partners, and then maybe they can help approach the federal VA.
But this was, so moving on from the VA question, thank you for that added piece on the VA. The issue about rural access designation not allowing them to do direct involvement. We're discussing how to partner together as a lack of housing is so important. Is there any perspective or guidance on how we can partner given their restrictions? And so, yeah, I hopefully you've gotten some ideas on other ways to do that through our case studies here. I think we already talked about the definition of healthcare institutions and how we started pretty narrow but have kind of broadened that. Match individuals we talked about. Will these programs provide funds to offset costs related to implementation of HIPAA compliance in nonprofit organizations? Do you want to talk a little bit about data sharing? We haven't really talked too much about that, but that's a biggie.
So certainly, HIPAA is, with the healthcare system is challenging, but, part of the capacity grants that we're offering could be covering some of those relationship agreements that need to be addressed. So if you want to develop a relationship with like an FCS provider or a healthcare provider for permanent supportive housing, so that relationship agreement that, either an MOU or a business associate agreement, and just make sure that, data, HIPAA covered, data sharing is, covered in your MOU, that you could get a lawyer to help cover that, address those issues. HIPAA doesn't have to be as scary as it sounds. I think if you have good protections, I think everybody has secure data as long as you're not blasting people's names and IDs and things like that. That's the basics of HIPAA as well. You're not sharing diagnostic information or PII, personal identifying information. That's pretty much the bottom line. Don't share names. Don't share any information about people. And I think that's but certainly get an MOU created, a business associate agreement, with your partners, which is good practices anyway. And some of our capacity grants can help cover the costs of those business associate agreements or MOUs.
So then there's kind of a, I don't know, what should we call this?
The streamlining question, the age-old systems piece here. With so many funding sources, how can we better streamline compliance and inspections? That's a good one. Anybody have any great ideas? We've been working on this for many years. I've been in this industry 30 plus years, and this was what the web-based annual reporting system and sharing compliance, we started many years ago, and we've had fits and starts over the years because certain things have changed for one of our funding sources, and so it's either worked or not worked as well. Certainly through the pandemic, compliance and inspections has taken a different tact, right? So where are we now? I think we have an opportunity to regroup and think about that. Again, one of the things that excites me the most is about streamlining eligibility. So I think we just, convening as we have been has been super helpful in illuminating some of these challenges. And so then it's like, how can we solve them? So I think that's part of the next step is, we try to identify things that we thought we could take on. And the eligibility piece and the mapping piece are those two pieces. And then I think from there, it's like, okay, now that we've mapped all this, how can we think about this? I'm hoping that in and of itself will help illuminate, how we can think about things differently. Constantly trying to challenge ourselves to continue to think out of the box and hearing what the challenges have been. I think it's been great that the cohort of folks who have already gotten funded through AHA, and then hopefully you will continue to do that cohort. We are now sitting in those meetings as part of that stack. And so can we find other ways through that learning to really support streamlining, I think would be a really big opportunity. And then there was a question about will there be partnership funding available for existing low-income housing? I know we've pushed Tracy a little bit at the national level to see, is Robert Wood Johnson, what's Robert Wood Johnson going to do? They funded 6 states with just this planning money, come on, are you going to give us any more? Where are we going to go next? And I don't know, Tracy, if you can say anything about that.
I promise you we're working on it.
Yeah. There you go.
But
So we'll
to
see.
the existing affordable housing, in our cohort at least, it wasn't all about new construction. It was about both preservation and new construction.
And then Melody, are you thinking any of the TA or capacity, or have you thought much about how some of the resources you have could support existing, or is it really just new?
No, it's absolutely existing.
Oh, great.
Certainly existing housing can, because we also want to focus on the quality of permanent supportive housing, and so we have technical assistance available. I think there's always opportunities to, improve the quality, but I think there's also opportunities for partnership. Bringing in a nurse, I think there's opportunities, especially as you have maybe tenants that are getting older, partnering with ALTSA to maybe bring in in-home caregivers that, for folks that may need help with their adult daily living skills. So maybe maybe a person needs an in-home caregiver so that we can help people age in place. So maybe it's partnering with ALTSA to find out how can we help individuals stay in their homes longer. Maybe it's bringing, having a behavioral health person come out and visit people. How do we have FCS service providers visit people in their homes? Rock the boat. How do we help people go back to work? And there's actually part of the FCS service program that is about supported employment. And if you actually look at the definition with permanent supportive housing, it's actually also about helping people go back to work. And so people can work, and it's part of recovery. And so it's how to do that and support people along the way. But supported employment actually is crucial and helpful and part of recovery. And so just doing it along so that they don't rock the boat, they don't lose their benefits, but they don't lose their housing, but there's a way to do that. And actually the principles of supportive housing and supported employment are very parallel. So how do we help people go back and recover and be part of their community?
So Great. I think we've got like a minute left, so I could take one more comment or question from the audience, or just thank you so much for participating and hope that this was helpful information. Thank you. Thanks.